COVID-19 cases and deaths are climbing in Illinois. State public health officials reporting nearly 41,000 new infections and 56 deaths over the past week. Hospitalizations are also up by about 20%, not quite 20%, but close, hitting levels not seen in about 3 months.
That's the number people are definitely watching. Tia's back with more on today's COVID Outlook.
You're absolutely right, Sally. People are watching. The case rate has been slowly rising in the state. As of this afternoon, 8 Illinois counties were moved into the CDC's high community level ranking. Dr. Nimmi Rajagopal is an associate chair of family and community medicine with Cook County Health. Thank you so much for joining us.
Thank you for having me.
You know, let's talk about this because a lot of people are concerned when we talk about medium transmission. What does that exactly mean for Cook County and Chicago?
So, we're seeing a slow uptake here in cases, and there's a lot that contributes to that, right? So we've loosened the mandates a bit, and we really need people to take those precautions because that rise is still significant enough that we're concerned.
We're at medium risk right now in Chicago and Cook County, but what is the likelihood of our rating being increased, and what would mask mandates, what would that mean in terms of them being reinstated?
So I can't speak to what the threshold necessarily would be for the mask mandates to be reinstated. What I can say is that we need to use common sense even when there's not a mandate, right? Because that's what's going to prevent us from getting back to the mandate or from getting to a more critical level or being upgraded on that list. So masking, in big crowds, masking at large gatherings, taking those precautions, taking precautions if you're traveling, and making those choices now to keep us from going up on that list.
Let's talk about vaccines because we have had some new news to come in this week. The CDC is now recommending COVID-19 vaccine booster shots for children 5 to 11. Some parents are still hesitant right now. What do you have to say to those parents and even adults who have yet to be vaccinated?
Well, I think that we have to remember that this has just got heightened awareness, but this is like every other vaccine. So we have a lot of vaccines throughout childhood that we give boosters for. What we know is our immunity is only strong for so long, and it varies with every vaccine. So this is a booster like any other. It's to help us just to get a stronger immune response. So there are people that really should consider it now. Of course, if you're at high risk, if you're immunocompromised, diabetic, those are people, and any sort of lung disease, those are people that should get the vaccine booster without question now. If people are hesitant, they can wait a little bit longer, if we're looking to keep people protected through if there is a surge. But we want people to just remember that the same studies have been going on. We're not taking this decision lightly.
All right, Dr. Nimmi Rajagopal, thank you so much for joining us on First at 4. Thank you for your insight.